Okay, good morning everyone, or actually it's now afternoon, so good afternoon everyone. My name's Ashok Jansari and I'm a cognitive neuropsychologist, and what that means is that I primarily work with people with different types of brain damage to try to understand how the normal brain works, and then eventually, if possible, to try to develop rehabilitation. So, for example, one of the areas I work in is memory problems and amnesia. So I study people with profound memory problems to try to see what that tells us about how normal memory works, and then eventually, if possible, develop rehabilitation regimes for these for the patients that I work with. So right at the outset, I'll make an apology that if I use words that don't terms that aren't appropriate, like rehabilitation or treatment, I'm not trying to see you as patients. It's just because of the background that I come from. Okay, the allusion to the Science Museum, which is in the program, is the fact that I'm running an experiment for 3 months at the Science Museum on face recognition, and this is part of work that I've been doing for a little while, and actually is carrying on some work that Brad has started up, looking at the whole spectrum of face recognition, prosopagnosia that we're talking about today, but also people who are at the very other end of the extreme, who are incredibly good at recognizing faces and might recognize someone 5, 6, 7 years after just a fleeting meeting or a fleeting glance of them in a foreign country, etc. So I'm going to be doing this experiment at the Science Museum, and so if you are interested in it in terms of educating people that you know, you could send them to the Science Museum, and we'll be in the Who Am I gallery, which is rather appropriately named. It's actually a gallery within the Science Museum, which they give over to this thing. I will be around for the rest of the day if anyone wants to talk about it. So in terms of prosopagnosia, it's an area that I've only been working on for a few years myself. And as I said, I work primarily with people with brain damage, but a few years ago, I started working on the developmental variant as well, because as Brad said, most of us didn't realize that there was a developmental variant, and then I found out there was one. And at that point, I'd sent an email out to a synesthesia group, in fact, and this is how I met Monica the first time, because I heard that there are some people with synesthesia who were also face blind. And one of my students came up to me and she said, Ash, I didn't realize there was a developmental variant of prosopagnosia, because she knew I worked on the acquired version, which I'll talk about in a moment. And I said, nor did I until relatively recently. And she said, I think I might have it. I said, really? Now, I'm an identical twin. My twin looks exactly the same as me. And she said, do you remember when you showed me the picture of you and Ajay, my twin? I asked you whether you were related. I'd actually forgotten, but she fessed up and she said that she hadn't recognized our faces. So we actually did Brad's test on her and found out that she falls within that bracket. So I'm a latecomer to the developmental prosopagnosia field myself. So what I'm going to be talking about today with you is a study I've been doing for about 1.5 years on looking at different types of rehabilitation regimes and seeing whether any of those might offer hope for helping people with prosopagnosia. And as with most research like this, I've done very little of it myself. It's been done by various students of mine. There's a wonderful woman called Barbara Wilson in Cambridge who's helped me find participants, and these are the participants that have contributed to my work. It's going to be slightly scientific, but I'm going to try to keep the jargon to a minimum, but I'm happy to explain any of it for anyone if they want. So just an overview. I'm going to give a very, very brief overview of prosopagnosia, then review the study that I'm effectively trying to replicate and extend, tell you about the study, and then future directions that I've got. So, prosopagnosia, as I said, from my work, we know of it as being acquired through brain damage, through primarily areas of the brain over here, on the right-hand side, lower down, around behind the ear area. But as we've been talking about it, there is a developmental variant that many of you experience, and we're not sure of what's happening in the brain, although that's the work that people like Martin and Brad are doing as well. And so the work is trying to work out what's happening at the developmental angle. what is the impairment that's actually causing this? And that, from a scientific perspective, is very interesting, but that might also shed light on how we might be able to help people, which is how we work in the amnesia field as well. So if we can work out what the problem is in amnesia, then we might have some hope in trying to help the patients. So in acquired prosopagnosia, is the one where people have been completely okay, and then at some point they suffer some form of brain damage and they acquire a disorder. In this case, it would be acquired prosopagnosia. Now, in research terms, there is a suggestion that when we look at faces, we see the face as a whole. So rather than seeing my left eye, my right eye, my nose, my mouth, my chin, etc., you see one whole or a gestalt. So faces are seen as a whole, whereas objects, like that chair, are seen piecemeal like a jigsaw. You see the four legs, a flat bit that you sit on, and a back support, and you work out that that's probably a chair. So the general idea is that faces are seen as one whole, whereas chairs, watches, etc., are seen as a piecemeal jigsaw that you add up together. So there are some people don't agree with this, but this is accepted by many people. So one of the suggestions is that prosopagnosia, at least in the acquired sense from brain damage, is a problem in that holistic seeing the whole. So there's a problem in being able to see the whole as one thing. And so what happens is that the person with acquired prosopagnosia has to rely on the featural method, which is adding up the eye, the nose, the mouth, etc. And that may not be sufficient for accurately recognizing a face. So I've been doing work with someone for a few years, and that is David here. David doesn't mind me naming him. And this is a scan of David's brain, effectively as if you'd sliced his head, but I'll demonstrate on mine. If you'd sliced my head off over here, and this is the back right-hand portion of his brain around here, and this is the brain area that's been damaged in because of David's brain hemorrhage. And after his hemorrhage, David was in coma for about 4 weeks, wasn't it? Yeah. And he thankfully eventually pulled through, and he had a number of problems at the time. But eventually, the one problem that didn't go away, well, there are two, in fact. The one problem that didn't go away was his inability to recognize the people around him. And he couldn't recognize the little people running around him, who were his grandchildren. He couldn't recognize the woman who was crying in the chair next to him, and that was his wife. Remarkably, David could recognize, he said that he recognized the footsteps of someone walking up there, and it was his wife. So just like Joe mentioned, gait and things like that, people's walking style, he could recognize. So the other problem that David still has is the route finding difficulty, and I've been doing some work that I think Monica has contributed to as well, and David has, to look at whether these two things, face recognition and route finding, they might co-occur at some level, but that's an open question at the moment. So David's already stolen my thunder. He couldn't recognize this person in a test that we were giving. And then at this Brain Awareness Day that I try to do every year during March, I'd shown this photograph of another person, and this is during the whole, the height of the Iraq War, etc. And this person wasn't very popular, so I showed this face as the one that we all recognize, and David said to Scott, "Oh, I didn't even recognize myself up there." And for those of you who are prosopagnotic, that is George Bush, by the way. Okay, so these were examples of people that he didn't recognize. Now, one day, David was coming to the university to be tested, and Scott had said to me, bringing David in, I said, "Bring him up to my office so I can say hello." And I just happened to be walking outside my office as they were making their way to my office, and I saw them coming down a corridor. So I said, "Hello, David," and he said, "Hello, Ash." I thought, "You're not supposed to recognize me." And some of the work that I do is on people with memory problems and people who feign memory problems for compensation, etc., etc. I thought, I hope I haven't got one of those here with the face thing. Not that there's that much you can gain by pretending you've got face recognition problems. So I said, "I thought you didn't recognize me." And he said, "I don't, but you're the only reason I come to the University of East London. So if someone says, 'Hello, David,' you're the only one who knows me here apart from Scott, so it's likely to be you." So that was his 2 + 2 must be Ash. So we thought we'll try this out, and some work that I think is kind of related to work that will be talked about later is that in some patients with this acquired prosopagnosia, when you show them a face that they say, I don't know, you actually get a skin conductance change, which shows that at some level internally there is a recognition going on. And the person isn't lying, it's just that at a subconscious level the recognition is actually happening. And that change in skin conductance is indicative of this unconscious recognition. So we did this test with David to try to see if we could find this. And so the standard thing that you do in these tests is you show famous faces, people that the person is related to and they work with, and non-famous faces. And they just have to say whether they know who this person is or not. So we were doing this task, and I think Scott suggested that we put my face into the task along with David's wife, etc. And they came to my face, and on that day he wasn't expecting to see me at all. So he saw this face, and he quite confidently said that this was George Michael, which to me, given what George Michael has been famous for recently, wasn't good news. Okay, so what's happening here? Now David saw an earring, a goatee beard, and so he went through his 2+2 thing. They're trying to show me these famous faces. Who do I know who's famous, who's got a goatee beard, slightly darker skin, a gold earring? What's my 2+2 going to give me? It's probably going to give me George Michael. And so that's why he thought that was me. And he did actually say, if I shave this off, he won't be able to recognize me, or he'll have to find another way to recognize me. Unfortunately, I have played a trick on him by introducing him to my twin. And of course, the gold earring plus the goatee beard doesn't work in that case. To test this out, we actually did an experiment looking at if we chopped up a face like this, given that David doesn't see the hole anyway, does it make a difference to whether he can recognize this face or not? So we showed him this face, and also this one, and we looked to see whether there was a difference in his ability to recognize the face. And these are the results. So here, these are people who are the same age, and men who are the same age as David, and this is David, and this is the reaction time, so how quickly these people were able to recognize the faces. And when the face was intact, so Bob Geldof, etc., as a whole face, for people without brain damage, it took just over 2 seconds to recognize the face. But when it was chopped up, it doubled the time to recognize the face, which you probably found yourselves. It took a bit longer to recognize that face. In David's case, it took him a bit longer to recognize the chopped up face, but in fact, for the face that was intact, it took him longer, the complete opposite of people without brain damage. And there is a suggestion that what's happening there is that the whole face actually gives more work to the prosopagnosic brain, certainly in the acquired case, to do. And David said in the chopped up condition, he actually knew, okay, I'm going to try to find a nose that I recognize or a chin that I recognize, etc. This hasn't been done on that many patients, so it's obviously something that's speculative. So this is slightly the background of the work that I've been doing. So looking at them in terms of developmental prosopagnosia, and this has been alluded to already, that until relatively recently there were not that many well-documented cases of developmental prosopagnosia, and yet now as more work is being done, there is a suggestion that it might be up to 2.5% of the population who has this, which is actually quite a large number. And there is evidence that Brad has contributed greatly, that the deficit can run in families, and we've already seen that Jo said that her daughter has got prosopagnosia as well. And that suggests some sort of genetic component, and that's what some of the labs are looking at. So, in terms of rehabilitation, in terms of helping people, there's been very little work. There's a study done in Cambridge which used a particular paradigm, and I won't tell you what the paradigm is because this is what us cognitive psychologists as nerds are interested in. You don't need to know about it. Looking at these particular paradigms on 2 individuals with acquired prosopagnosia to see if we could improve, or they could improve face recognition in them. And then another study in Sydney, which directed visual attention to specific facial characteristics, kind of like the goatee beard, etc., on a 4-year-old with developmental prosopagnosia. But both studies were only training for recognition of familiar faces and also had limited success. And one of the themes that's come out today is how do you meet new people? So what I wanted to do was to look at unfamiliar faces and therefore new people. So what about this sort of work? A study done at Goldsmiths by Jane Powell and Tim Valentine and colleagues was the first major study to look at rehabilitation of previously unseen faces. And they had 4 conditions, and I'm going to give you examples of some of these in a moment. And they found that 3 of these conditions, which are the ones that I'll show you in a moment, resulted in better performance than just simply showing the face, which is effectively what you guys have to do when you go to a party. You just get shown a face and this is Bob, and you've just got to try to learn that. So simple exposure is the analog of that. No help whatsoever, and the other conditions are the ones that are to do with trying to improve that. It was a very good study, but the group was quite mixed. It's heterogeneous. There's only one patient with pure acquired prosopagnosia, whereas the other people in this particular study, they all had brain damage, by the way. The other people had general visual problems. Only one of them was diagnosed as a prosopagnosic. So it's difficult to generalize to other prosopagnosics, especially developmental prosopagnosics. So that was the springboard for my work, which is to extend this work that Powell and colleagues did with 3 people with acquired prosopagnosia and 1 person with developmental prosopagnosia. These are the characteristics of my participants. So these 3 have got acquired prosopagnosia. David had his through a brain hemorrhage, and 2 of the participants ended up with prosopagnosia consequent to herpes simplex encephalitis, which is quite a nasty disease that causes a lot of brain damage until it's caught and treated. And then finally 1 developmental prosopagnosic, although we are testing other people as well. Okay, so we had 3 different conditions, and I'll explain roughly what they're about. So simple exposure is the classic party thing. Hello, this is Blake, and that's it. Part recognition is effectively capitalizing on that thing of looking at particular features. So here we'd say, this is David. David has eyebrows that join in the middle. He has small nostrils and large lips. So directing attention to specific features which might help in remembering that face, rather than relying on just seeing the face as a whole. Then the final one is a caricaturing condition, where this is what Powell and colleagues did, so we followed the same example. We took the face, and then using particular software, we exaggerated it. So we morphed it so I'll just move between those, and you see that the face, the eyebrows, etc., become more arched, the mouth becomes more pinched, etc. And this was to try to make the face look a bit more exaggerated, and then we gave the name as well. So we've got these 3 conditions: the simple exposure, the part recognition, where we say, look at his eyebrows or look at his nose, and then this one where we just exaggerate the face to actually create these things that the person might be able to look at. Okay, so what we found, this is the simple exposure. We did it twice, the part recognition and the caricaturing one. The convention for scientists is that if there's a significant difference between our people without prosopagnosia, which we've called NCs here, and the person with prosopagnosia, we put a little star over here. And what we find here is that in all of our conditions, there's always a significant difference between the person with prosopagnosia and the matched controls, irrespective of which of these conditions we used. There was a bit of an advantage here with the caricaturing condition, which I'll come to in a moment. And then this is one of our people with acquired prosopagnosia, where it seemed that the simple exposure condition, just showing the face for some reason, was easier, and I'm going to speculate on that later on, whereas the caricaturing and the part recognition weren't as successful. Then our second person with the acquired condition, again, there's a hint that the simple exposure was easier than the other ones. And then finally, in David's case, what we found is that there is actually, compared to the other people, there's better success rate. And in this one, the caricaturing condition, in fact, the lack of an asterisk there implies that he was actually within what we call normal limits. So his ability to recognize the faces had actually become good enough by the second time we did it. This is the first time we did it, this is the second time we did it. David's face recognition for those faces actually came within normal limits. So those were the results, and I'm more than happy to talk about the details with anyone if you're interested later on. But just to summarize, the results showed that individuals with prosopagnosia can learn to recognize faces, because you saw that all the red bars, they weren't at 0. They were above 0, so that itself is hopeful. They didn't all come to normal levels apart from that last one with David, but I'll talk about that in a moment. The 3 different regimes did have variable success, and there wasn't a clear-cut sense of if you've got developmental prosopagnosia, this one is better. If you've got acquired prosopagnosia, this one is better. But again, this is something for future work to look at. There were some factors which often us scientists have to look at that can impact our results. The first is the level of prosopagnosia, and we've already heard people use the terms mild prosopagnosia. I've got it quite mild. Someone else says I've got it really, really bad, etc. So the level of prosopagnosia will impact performance on this task, and that's something that we've got to grapple with in terms of assessing what works best for each person. The second thing is for the people with the acquired prosopagnosia, the brain damage, the cause and site of the brain damage impacts what's happened. And so by this, I mean that David's brain hemorrhage resulted in damage that's restricted just to these right hemisphere areas back here. But the 2 individuals who'd thankfully survived the encephalitis, because it can kill people, they had damage that goes further into the center of the brain, into areas of the brain that we're quite confident are involved in memory as well. And so these 2 people have got damage that's actually more extensive and affects memory areas as well as possible face recognition areas. Now, one of the things that I always point out to David is that his memory is as sharp as a button. That thing with George Bush happened about 4 years ago, and he can still remember that. And he'll phone me up and he'll say, "Are we still meeting in 3 weeks' time?" So his memory is completely okay. Whereas if we've got these 2 individuals who've got memory problems because the brain damage has resulted in areas of memory areas affected, then there is a complicating factor there that researchers certainly, or anyone working in rehabilitation, has to consider. In terms of a general pattern, what I would suggest is that people with pure acquired prosopagnosia, the part recognition and the caricaturing condition are actually easier than the simple exposure one where you just show a face. So somehow caricaturing the face or directing attention to particular features seems to be helpful. With the acquired prosopagnosics who might have survived the encephalitis, where memory centers might be affected as well, it seems for some reason, and it's something that we need to speculate on, that the simple exposure condition for some reason is the easiest one, and I'm happy to talk about that later on if we want. And then for developmental prosopagnosia, certainly in our very, very small sample, but as I said, we are trying to extend it, the caricaturing condition and the part recognition condition seem to be about equal, but they are certainly better than simple exposure of just seeing a face. Now, what I want to just quickly refer to is, what do we count as effective rehabilitation? So what do we count as improvement in face recognition? Now, if we were just interested in whether someone is within normal limits, then only this condition here, where there's no asterisk here, would be useful in this particular case, because in all of these other ones, the person hasn't quite achieved normality. But that might be too harsh a thing to aspire towards. If we want to go for which is the one that results in the best performance for the person, then that might result in a different answer. Or we might be interested in what is the biggest improvement over time. And as I said, we did the study once and then we did it a second time on the same faces. And if you're going to see the faces over and over again, then maybe change over time is the important thing. So if you can only recognize 2 people in a room one particular time and the next time you can remember 6, even if there's 14 people you don't recognize, the 6 is still an improvement on the 2. So maybe improvement from the first time to the second time in a training regime is the important thing. And these are again questions that we've got to grapple with. Okay, so possible theoretical and applied speculations are that since the aim was to increase memory for faces, we have managed to extend the work that Powell and colleagues started up in London, and we've been able to extend it to people with developmental. We've managed to extend it to people with developmental prosopagnosia, which is good because their original study was just on acquired. So at least we can show that it does help with developmental prosopagnosia. Individuals with developmental prosopagnosia would probably benefit more from procedures that caricature the face. And this theoretically is something to do with what Tim Valentine has talked about, but I'll just move on. And then individuals with acquired prosopagnosia, where we know that the problem might be to do with seeing the face as a whole, hence that Bob Geldof chopped up face, they might benefit better from procedures that highlight individual features. And then finally, individuals with presentation of acquired prosopagnosia, where there is a memory component to it as well, those people with encephalitis, they will need more intensive training. So in terms of future directions, we want to expand this work with other prosopagnosics, including a family of 3 siblings, and I am trying to do it with anyone who's interested in this work, so please see me afterwards if you're interested in taking part. I've got someone who became prosopagnosic at the age of 3 months from she had brain damage at the age of 3 months, and therefore has got brain damage, and so is actually an acquired prosopagnosic, and it's quite rare for us to find someone who had damage that early who then develops the condition, but I want to look at her. And then see if the study can generalize to known faces. So we've done unknown faces. What I'd like to do is to do known faces as well, so a study where we have faces that the person knows as well as the person doesn't know. So, thank you very much.
Can I ask some questions quickly before lunch comes along?
Yeah, I was wondering if you've found any relation between acquired prosopagnosia and the Capgras delusion. It intuitively seems like acquired prosopagnosia might be a reason to have that.
In fact, my understanding of it is that they're quite the opposite of one another, because with the Capgras syndrome, for those of you who don't know the Capgras syndrome, it tends, as far as I know, to follow brain damage. And what happens is that the individual claims that usually their close family members are imposters. So they see someone like their mother and they will say, "You aren't my mother, you're an imposter." And it tends to only happen for close family members. It doesn't happen for the milkman, the postman. It tends to be for close loved ones. And what we've got there is a reverse of what we see in acquired prosopagnosia, where an inability to recognize the face visually, but sometimes from the galvanic skin response, emotionally, whereas in this case, what we might be seeing is somehow the face is being recognized, but the emotional thing isn't coming out. And because the brain isn't getting that warm, fuzzy feeling that you should get when you see your mother, the brain is somehow interpreting this as, this can't be my mother because it looks like her, but I'm not getting the feeling for her. So that's the explanation I've heard a number of years ago. I don't know how far things have moved from then. No, yes.
I also add there's at least one case of Capgras delusion in a blind individual based on recognition based on voice. So it seems like it doesn't have to involve face recognition at all. Probably involves more frontal damage.
Yeah.
I'll say too, we've had something like 6,000 developmental cases registered with faceblind.org. And there have been a couple cases over the years that I thought might have had Capgras too. Then when I followed up, they didn't. So that's a big sample where we haven't seen it at all.
Well, you wouldn't expect to see Capgras in developmental prosopagnosis that would go required, but it's
abandoned.
Okay.
Oh,
I don't know whether it relates, but the kind of prosopagnosia that I recognise is that a face is not there, but when I get the context, then the face reappears. So as I'm talking to someone who I absolutely don't know, as I realise why I know them, they know me because they're telling me, then it's like one of those pictures where you do water on and the picture appears, the face reappears, and I know them totally. So that kind of connection doesn't relate to any of the kind of things that you've been saying at all. I'm just saying from another thought there.
there's a kind of complex answer there, I think, and Brad, do jump in if I'm getting this wrong. The brain, when the context is telling you, I'm at this party, this person is wearing these clothes, I can recognize their voice, etc. The brain is telling you this is John Smith. And at that point you've got recognition, but you haven't got recognition of the face. Now, depending on how you might have stored your information on that person, then there can be a filling in. Now, I'm more familiar with the acquired cases than the developmental cases. And in the acquired cases, there is work that's being done, which has shown that the actual, let's say, the photograph that's stored of the face in the brain is still intact. It's the ability to attach what the person is seeing in front of them with the picture in the head. That connection has been broken, at least in some cases. So, for example, we did some work with David where we asked him to imagine what someone looked like, and asked him to just describe a particular face, and then we asked someone, who does this person make you think of? And it might be Barbara Windsor or something like that. And his descriptions of these people are actually completely okay. If we showed him the face of Barbara Windsor, he might have been a chance at recognising. So in the acquired cases, there is a speculation that the picture in the head is there. It's the connection with what someone's seeing in front of them to that picture that's been damaged.
It's developmental too.
It may be, but as I said, I don't know.
Right, can I, we can all chat about this while we're having lunch.